is it not still sucking? So you feel like they're sucking that the baby, an innocent baby, is doing, like eating innocently, is going to give you sagging breasts, and they want that Oga is not just maybe going to suck, going to massage, going to tip left, right, and center, and then you refuse to give a baby a healthy or a good, healthy lifestyle because you are afraid of sagging breasts. Note, if you are somebody who have sagging breasts, you feed that baby, or you breastfeed that baby, or you don't breastfeed that baby, it's still going to fall. There are a lot of women who have breastfed at least 4 children, and if you look at them, you will not even believe that they might have breastfed a child. Not to talk of 4. Their breast is still strong, it's hanging, and oftentimes we get to do this thing because we don't know how to take care of ourselves, especially during pregnancy or after you must have given birth. That'll be a topic maybe for next week. Yes, you get into a woman's room and it's smelling and all. Let's just keep that aside. Let's talk about breastfeeding. The baby's life matter. So today when we talk about breastfeeding, we talk about the feeding of an infant or a young child from the breast, like directly from the human female breast. That's what breastfeeding is all about. Not the one that you get to mix milk maybe in a bottle, or you mix pap in a bowl and put milk there. No, that's not what we call breastfeeding. Like you eat everything that you want to pass on to that child, and then you give them through breast milk. That's why you get to hear maybe most often a breastfeeding mother will tell you that, give me the apple, give me this, you go take them for Bobby. Which is really very true, and they get to encourage you and advise you, mother, you're not supposed to take this, you're not supposed to take this. Maybe if you take this one, it will provoke jetty, it provoke rougeur, it will give the pikin running stomach, it will make it grow fine. You're not supposed to do this one. Those are the kind of things that you're supposed to know and note during breastfeeding. But we will not be talking about that. We'll be talking about you, giving you reasons, good reasons why you are supposed to breastfeed that baby. Like it or not, it is a win-win story. You win while you breastfeed the baby, and the baby also wins something from being breastfed. Let's talk about the benefits of the importance of breastfeeding to a mother. For the mother, it protects you against breast cancer, against uterine cancer, against diabetes and postpartum depression. Especially maybe you're one that went through labor for about 2 weeks, 3 weeks, maybe more than 4 days. Sometimes you even get to pass out, you are in a coma, and maybe they get to do you C-section, and then it keeps getting bad, maybe torn open and all that. The depression and the stress is too much. So if you get to hold your baby and breastfeed them, number 1, breast cancer is not your portion. Number 2, uterine cancer is not your portion. Number 3, diabetes is not your portion. If you want to know what it means to have diabetes or to be free of diabetes, to be thankful of not being not being somebody who gets to suffer from diabetes, ask people who have a little wound, who are people who get to suffer from diabetes, type 1 or 2, and they have a little wound. Ask them the miracle. It doesn't get well. Especially if the worst is just somebody who has maybe you have to get, maybe you had an accident and then the leg is broken and torn and all that. Take for instance somebody like Mama Ngea, may her soul rest in peace. That is one of the things that got her to the grave. Why? Because of, even though all the money was coming and everything, she was a sufferer from diabetes. It is difficult for somebody who has diabetes to get into the theater and come out in one piece. It is difficult for you to maybe get your leg amputated and then you get to live again as normal. It is really very difficult for you to maybe have a wound, maybe on an accident, on a bike accident, and then the place maybe is torn, is burnt, and then for it to get healed normally, it is not easy. Let's talk about the importance for this, for the baby. For the baby, you have gets to protect their immune system, protects their bladder, their tummy, their lungs. It helps with their teeth, their ears, and gives them healthy weight. When we talk about all of this, it gets to protect them from every infection and diseases that comes or that have to do with their ears, their teeth, and everything. They will not get to suffer maybe from tooth decay and all that. Let's talk about the benefits when it comes to breastfeeding. First, for the mother, like it or not, there is a whole lot of benefit. The first thing is that you're not going to get pregnant anytime soon, especially if you get to breastfeed that baby for exclusively 6 months, and then you get to add maybe 3 extra months on it. Breastfeeding is a natural contraceptive. If you didn't know that, you should know it today. Another thing is that it doesn't just only get to keep you away from all the diseases and infection that might come with you not breastfeeding your child. It gets to make you lose that belly fat easily. Sometimes you get to see women, how you do it? Your skin don't even look like say you don't even born safe. Yes, that person took out time to breastfeed their baby, and before you know it, their tummy is as flat as anything else. They don't even need to tie maybe a waist trainer or go through that stress or tying their stomach. Trust me when I tell you that when you get to tie your stomach after you must have given birth, for them to whip your waist maybe with warm water or come and tie it with hot compressor, it's not easy. Why don't you go in for an easy natural way? Just get to breastfeed that baby and then get out to have a win-win kind of something, win-win situation. You know, you don't have anything to lose, because like it or not, it is really very important for you to be able to breastfeed your baby. Plus, when you are breastfeeding your baby, most often, if you maybe you're somebody who is an alcoholic or somebody who is addicted to smoking, they will advise you to stop. And when you stop for that 6 or 7 months exclusive breastfeeding, there is a high probability that you will not go back to it. It just becomes your lifestyle. Like, you don't want to go back to it. You just stop being an alcoholic. You stop being a cigarette addictive somebody, which is very healthy, which means that it gets to promote your life a little bit longer. Plus, you also have less uterus bleeding quicker. You know, when you get to give birth to your child, when you're pregnant, you don't get to menstruate, and then when you give birth, now the blood flow starts. And for some people, or for some women, the packet of this, they have a particular part that they will assign you to buy. Some people will buy maybe 3, some other will buy 4. Yours can be 10, depending on how serious you get to bleed. If you breastfeed your baby maybe for those first 1-2 weeks, there is a high probability that bleeding is going to stop quickly than you refusing to breastfeed that baby. And trust me, it is very uncomfortable as well as painful. You cannot be able to sit in the same place for a very long time. You may not be able to do anything because you're always going to check yourself. Plus, breastfeeding is really very cost effective. So why don't you just take out time to breastfeed your baby? You eat all the things and then you give it the baby. You don't have to start thinking, well, milk na this, na 4-8, the one na 3. You don't even have the money. Maybe you're supposed to buy diapers, you're supposed to buy water for the baby, you're supposed to buy medication and all, and then you're thinking about milk, you're thinking about custard, you're thinking about banana mixture and all that. Sometimes it's frustrating. But if you get to breastfeed this baby is going to lead a healthy lifestyle. Like, it's going to benefit them in the long run. They grow old and they don't get to suffer from diseases like cancer. They don't get to suffer from diseases like lung infection. They don't get to have tooth decay. They are strong and healthy. Plus, it is really very rare that you might get to have that baby having maybe fever and this, except otherwise, maybe your village people are dancing pachanga on your head, or that baby is trying to tell you something and you don't want to listen. Let's talk about the risks of artificial feeding. Yes, sometimes we want to, no, let's just do it. For the mother, you become pregnant sooner, you may likely die. There is a high probability of malnutrition, especially vitamin A deficiency. The risk persistent diarrhea, running stomach, which makes you to be dehydrated more. And if you're dehydrated, there is a high probability that you're going to look cranky, broken, shabby. Yes, you also have respiratory tract infection, which might, for now that we have coronavirus, there is a high probability that they might just think that you have coronavirus, and before you know it, they're checking the baby and all that. Meanwhile, it isn't so. You also have the risk of being overweight, like we had mentioned. There is a high probability of you maybe breastfeeding that your baby and then letting yourself take shape from what you were before you got pregnant and before you gave birth. There are a lot of benefits that comes with you being able to breastfeed your baby. You give them good optimal brain development. They reduce the risk of any kind of ear infection. You have otitis media, you have gastro, anything that has to do with maybe their intestine. They are protected against respiratory infection, including those that have to do with rotaviruses. Yes, you also have them being able to have good strong teeth that will not decay quickly. Plus, it lowers the risk to any kind and form of allergy. Who wouldn't want that? Those are the benefits that you are missing when you get to indulge into artificial breast milk. Meanwhile, you can just take all of this in. It's a lot of carrots, it's a lot of fruits, banana, apple, watermelon. Those are the things that gets to boost up your system. Plus, you should do it to eat a lot of yogurt. Take tea. When we say tea, not just empty, maybe tea leaf and all. No, a lot of milk and Ovaltine in it. It is really very good. You're going to look at your baby. The baby is round and plump. This is the kind of children that you look at them. You say, Father, this is the kind of children that I want for my office. It's hard work and sacrifice. That's what we gathered for you on Health Today. Hope when a better woman, they are breastfeeding mommy, they one day when I just born. When I don't hear word, yes, it is good and essential for you. 6 months is not going to kill you, like it or not. Like I made mention at the beginning of the program, if you are somebody who has sagging breast, there is nothing you can do about it. And if you're somebody whose breast has come to stay like tension, it is going to stay like that. So don't worry about that. Focus on the health benefits that you are going to have, plus the baby too, so both of you can lead a healthy lifestyle free of stress and night cries and high fever in the night. It's really